do that before I forget. Okay, so GI Phys. This is basically your GI tract in a nutshell. Here are your GI organs. These are the ones that you are going to be responsible for knowing. Mouth, esophagus, stomach, small intestines, large intestines. You do not need to worry about the rectum or the anus. I think you guys have plenty of life experience. I hope you know how they work. Okay. The other parts that we're adding to this are your accessory organs. Your accessory organs, there's 3: the liver, gallbladder, and your pancreas. Okay. So for each organ, what you are responsible for knowing are any relevant structures, enzymes / secretions. Okay. What is digested / absorbed, and then the pathos associated with it. Okay. So for each organ, those are the things that you're going to be responsible for knowing. My recommendation, make a chart. Make a chart. You have all of your organs on the first column on the left-hand side. Then you have a column for the structures, a column for the enzyme secretions, a column for digestion, a column for absorbed, and then a column for your pathos. Okay. So that's my recommendation for organizing this entire thing. Where is she at? Natalie, you like your whiteboard? This is the time to shine. Okay. Highly, highly recommend you guys break out the whiteboard for these. If not, use Microsoft Excel. Okay. Make a chart out of this. It will really kind of help organize your notes. Okay. And of course, if you want me to proofread anything, just send it my way, take a picture, screenshot it, whatever, and shoot me an email. Okay. As a heads up, some of these, there's none. So some of these boxes will be blank. Okay. So there it is, your GI tract. Straight shot from mouth to butthole. Question: is your GI tract inside of you or outside of you?
Both.
Yes. But the technical answer, your GI tract is considered outside the body. Your GI tract is considered outside your body. Think about your mouth. Your mouth is exposed to the environment. And if it's a straight shot from mouth to butthole, that means everything in between is exposed to the outside. Okay. So there's a little bit of a saying. Okay. You are a hollow tube of meat floating on a space rock hurling through space at unimaginable speeds. Fear nothing. These are just general functions of the GI. You probably already know them, so I'm just going to run past it. Okay. There are 4 layers to the GI tract. 4 layers to your GI tract. Okay. The one that I want to focus on is the, not the mucosa, the muscularis. Muscularis. Now your muscularis is made up of muscle. What kind of muscle do we find in the GI tract?
Smooth muscle.
Nice. Smooth muscle. Okay. So that means it is involuntary. So which nervous system controls your GI tract?
Somatic.
Somatic is voluntary.
PNS.
That's the peripheral nervous system, but some people abbreviate it that way.
Parasympathetic.
Yeah, parasympathetic nervous system. So it is underneath parasymp control. Okay. Couple of key terms here. Peristalsis. These are the wave-like contractions. Okay, and that pushes food throughout your GI tract. Okay, again, completely involuntary, controlled by the parasympathetic nervous system. So if I activate my parasympathetic nervous system, I activate my parasympathetic nervous system, rest and digest, does that increase or decrease peristalsis?
Increases.
It increases it. Therefore, if I activate my parasympathetic nervous system, what happens to smooth muscle contraction?
They relax.
Smooth muscle? Yeah, smooth muscle will increase contraction. You see what I'm saying here? Parasympathetic, rest and digest. Rest applies to your skeletal muscle. We're not talking about skeletal muscle here. Digest, that means we're activating our smooth muscle. Okay, so just be careful with that. All right, so starting at your mouth, it's responsible for chewing things. Duh. These are the different flavors: salty, sour, bitter, sweet, and then umami. Umami is the new kid on the block. This is a sense of savory. A sense of savory. So this is the best way I can describe it is it's Polydine flavor. It's what makes a steak a steak. You know, when it's juicy and it's savory, that's umami. Okay. Umami comes from the Japanese word umai, which means delicious. This slide right here, you don't need to write anything down. I'm just going to highlight something here. But things like temperature can change the way you taste things. For example, coffee. Who are my hot coffee lovers? Cold, iced? Anybody for lukewarm coffee that's been sitting on the counter for a couple hours? We got one.
Desperate times calls for desperate measures in nursing school. So if it's there and I didn't finish it, I'm going to drink it.
You know, I agree. You can't discriminate. You can't discriminate. Why? Generally, people like their coffee hot, or generally people like their coffee cold, because at these extreme temperatures, you can't taste it as well. You can't taste it as well. Coffee is really bitter. Another example, I have a Coors Light, I think, right? I haven't drank Coors Light in years. Coors Light, you guys know the can? They say you need to chill the can till you see the mountains are blue. Why would Coors Light want you to chill their beer before you drink it?
So you can't taste it.
So yeah, if you're drinking Coors Light, that's fine, but you can do better. You deserve better. Umami is savory, so almost kind of think of like fatty. So it's like butter or like animal fat kind of flavor. All right. So talking about your salivary glands, I do not care about the specific salivary glands. I'm just going to refer to it as salivary glands. In terms of enzymes / secretions, okay, I do not discern between the two. If it comes from that mouth, that's why I put it in this column here. Okay. First up is water. Why is it important to secrete water at your salivary glands? What does the water do?
It moistens the whatever you're eating.
Moistens whatever you're eating. I'm going to say dilute. You can say moisten, that's fine. Dilute food stuffs. Okay. Another thing that we find is bicarbonate. Okay, what do you guys remember about bicarbonate?
It like cancels out acidity.
Cancels out acidity because it is a,
Buffer.
it's a what?
A buffer.
Buffer. It can be one half of the buffer, absolutely.
It's basic, so
It's basic, yeah. So the idea of having bicarbonate in our mouth, exactly as you guys are saying, it's to neutralize acids at the mouth. Okay. This was from way back when. We're talking about we were still running from cave to cave and picking random fruit off trees. Most poisons in nature are actually acidic. So if I pick up a mysterious berry and I pop in my mouth and it's poisonous, I'm going to spit it out. The bicarbonate helps neutralize whatever poison's left. Okay. Next up, you'll see amylase here. However, I am very specific, right? Again, just because I'm a nerd and I teach nutrition. If you say amylase by itself, I'm going to count it wrong. You need to be specific and say salivary amylase. Salivary amylase. Because we're going to see amylase later on in the body, but salivary amylase. So anytime you see ACE, you know that it's going to be an enzyme. Okay, enzymes break down specific things. Anybody know what amyl stands for? Okay, I'll give you a hint. It's one of your 3 macronutrients. It's either carbs, fats, or proteins.
I think
What-
protein.
Not proteins, I wish.
I'm gonna
Carbs.
guess carbs since it says carbs on your slide there.
Yes, yes, it does. Enzyme breakdown for carbs. Okay, again, that's just how I shorthand carbohydrates, just carbs. Now I'm not going to get into like complex carbs into disaccharides, monosaccharides. No, carbs, good enough for me. Okay. The last one, salivary lipase. Again, you know it's an enzyme. What does this break down?
Lipids.
Fat.
So be careful here. It actually doesn't. Despite its name, it doesn't actually break fats down. The reason why I'm pointing this out is this is a very common trick question on the exam. Okay. Salivary lipase can't break down lipids, despite its name. Instead, it allows for lipid emulsification. Does anybody know what emulsification is, or to emulsify?
breaks it down into like smaller globs.
Yeah, kind of smaller globs. This allows things to mix. It kind of surrounds it into these like little bubbles, if you will. So oil and water. You have bottle of oil, bottle of water, you combine them, what happens?
Create like 2 layers, they stay separate.
Yeah, they separate. And which one floats to the top?
The oil.
Oils, very good. So I want you guys to imagine this here. You have a juicy looking cheeseburger with bacon because you know it's a fancy day today. You bite into this bacon cheeseburger and you swallow. Now there's a lot of fat in there, okay? If you didn't have salivary lipase, the fats and the waters would separate. The fats would float. They would float back up into your esophagus and into your mouth. So you get to taste your burger twice. Does that sound good? This is the idea of salivary lipase. When you have fat in your meal and you eat, that allows the fat to stay in your stomach because they've properly allowed those fats to mix with the water. Does that make sense? Okay. So again, doesn't break things down, but it does allow things to mix. Okay. So no crazy structures here, but these are your enzymes and secretions. Okay. So what gets broken down in the mouth? What gets digested in the mouth? According to this.
Carbs.
Carbs. That's all I'm looking for. What do we absorb in the mouth? Now, I'm not talking about medications. That's for farm. Leave that for farm. What macronutrient do we absorb in the mouth? Kendra, you got it.
None.
Exactly. There's nothing that we absorb in the mouth. Okay. So if I bite a stick of butter, is that going to go into my, or if I start sucking on a stick of butter, that's going to just stay in my mouth. Okay. It's not going to get absorbed into my blood. Same thing with protein, same thing with sugar. Okay. All right. Talking about the esophagus here. So the esophagus, we see peristalsis. We defined peristalsis as involuntary. Okay. So this is where we start seeing swallowing. So the question is, swallowing involuntary or voluntary? Well, kind of goes either way. When you start it, it's voluntary, but after you start it, Jesus, take the wheel, you got no more control. Okay, so I'm just going to simplify this and just say swallowing is also involuntary. Okay, in terms of relevant structures, you have these two sphincters. Sphincters are kind of like rings of muscle. Their job is to open or close. Okay, when they're closed, they prevent things from going through. When they're open, food goes through. Your upper esophageal sphincter, this is going to connect your mouth to your esophagus. What would your lower esophageal sphincter connect?
Your mouth to your stomach.
In between the mouth and the stomach. The final destination is the stomach.
Esophagus.
Yeah. It's going to connect the esophagus to the stomach. Nice. Okay. So, any enzymes or secretions that come from the esophagus? Nope. Do you digest or absorb anything at your esophagus? Nope. Moving on. All right. So talking about your stomach is relatively hollow. Cool. There's 3 layers. You do not need to know the 3 names. Okay. I'm just trying to illustrate something. You have 3 layers of muscles and they all run in separate directions. Okay. This is to help prevent rupture, but also allow the stomach to churn / mix contents. Okay, because your stomach is surrounded by muscle, we can pinch different parts of the stomach to help kind of mix stuff within the stomach, turn it into chyme. Correct. Yep. Chewing will be voluntary. Absolutely. I would say at the mouth, it's only voluntary. There's no peristalsis at the mouth. Good question. All right. So here are the different sections of the stomach here. Now, this is one thing that I personally have beef with. Your cardiac sphincter. Another name for your cardiac sphincter is your lower esophageal sphincter. But it is also known as the gastroesophageal esophageal sphincter. Okay, so what I'm getting at is there's three names. You can call it the cardiac sphincter, lower esophageal sphincter, or the gastroesophageal sphincter. I personally really like gastroesophageal sphincter. It explains it. Gastro is your stomach. Esophageal, that's your esophagus. The sphincter between the stomach and the esophagus. Cool. In the medical field, you're going to see cardiac sphincter a lot. You're going to see it a lot. Why? Heartburn. Okay, it sits right behind your heart. And when you have heartburn, which we'll talk about with pathos, it burns. You're actually burning the sphincter. That's why it feels like your heart's on fire, but it's not really your heart. This peeves me to no end. So, yeah, exactly. So hopefully that answers your question there about why it's called cardiac, but like it peeves me to no end because this has nothing to do with your heart. My way, I would always call it gastroesophageal. That's just me. Your pyloric sphincter, this is going to connect your stomach to your small intestines. Okay. The pylorus, this is going to control stomach emptying. Okay, so this controls how much your stomach lets into your small intestines. There's a picture coming up here that'll kind of help explain this. The fundus, the whole goal here is to trap gas, and there's some hormonal influence. Then the body of the stomach, don't overthink it. It's the body, it holds the chyme / food stuffs. Okay. So,
I have a quick question.
yeah.
For cardiac sphincter, this is still the one from the esophagus that we mentioned as well?
Correct. So let me kind of roll to a picture here for you. So this right here, that's known as your lower esophageal sphincter, or your cardiac sphincter, or your gastroesophageal sphincter. Three names for the same thing. Don't know why, sorry. But three names for the same thing. Again, for me, on my quizzes, my exams, you're more likely to see gastroesophageal. Medical field, you're probably going to see cardiac. I think I try to use cardiac a couple of times just so that way you guys aren't surprised by it. But I would say those are kind of, I don't know why there's three names there. Sorry.
What did you put on that last slide under body?
It just holds stuff.
Okay, I couldn't see it.
Sorry. So swallowing is both voluntary and involuntary. So Heather, in reality, it's both. But in this class, I'm just simplifying it and just say swallowing is involuntary, just to make it easy. Okay, I'm not going to make you decide where it goes from voluntary to involuntary. So here's your fundus. Okay, when you drink a carbonated beverage, all of those bubbles build up here. That's why you can end up belching. That traps gas. There's also an important some set of cells in there that actually release some hormones that we'll talk about. Here's your body. Here is that pylorus. That's what's controlling the stomach emptying. We're going to control how much food is let in and out of the stomach into the small intestines. Okay. And then your three layers of muscles, again, prevent rupturing, churning, mixing, etc. So here you're looking at the bottom of the stomach. These are known as gastric pits. Okay, so these are some of the important enzymes here. We're going to come back to mucus, but hydrochloric acid the job of acid is to denature or unfold proteins. Okay. To denature or unfold proteins. Enzymes, the important enzyme here is pepsinogen. Pepsinogen. What do you guys instantly know about pepsinogen?
Neutralizes acid.
Not quite. Close though. Ogen. Like
It's inactive.
it's inactive. Pepsinogen is inactive. Okay. Therefore, if we activate it, it will turn into pepsin. Question is, how do we activate that? Hydrochloric acid. Okay, so hydrochloric acid activates pepsinogen into pepsin. Okay, so let me kind of illustrate this here. All right, so hopefully you guys are seeing my screen. Do you guys remember what hemoglobin looks like? It's like this tangled yarn of noodles. Okay, that's a protein. So I want you to imagine that each of my fingers here are a protein. When they're interweaved together, okay, that's a protein. If I asked you to cut off just one of my fingers, and my fingers are interweaved like this, it's kind of hard to do, yes? The protein enters your stomach, it hits this mixture. It meets with hydrochloric acid, and hydrochloric acid ends up unfolding it. So now you see my fingers here. Pepsin comes by and actually cuts these proteins into chunks, into pieces. Does that kind of make sense? Okay, so it's a 1-2 punch. Step 1, hydrochloric acid is going to unfold or denature. Step 2, pepsin cuts or cleaves. Okay, hormones we're going to talk about. Intrinsic factor. Oh boy, this should sound familiar. We've talked about intrinsic factor. Where?
Clotting.
That's the intrinsic cascade. Close, close. It deals with an anemia. What anemia could be caused by a lack of intrinsic factor?
Pernicious.
Pernicious anemia. Very good. Intrinsic factor, this is your enzyme for B12 absorption. Okay, so let's actually, I'll save that question for a little bit later. Okay, the last one here, mucus. Why would your stomach need to secrete mucus?
To protect the lining.
Yeah, this is to protect that stomach tissue. Because what is the stomach made of?
Acid.
It secretes acid, but what is it made of?
Muscle.
Muscle. And what happens to muscles that are made of proteins in the stomach?
You break down?
Exactly. This is why we need mucus, to protect the stomach from breaking itself down. Okay. So looking at all of these enzymes here, let me ask, what is the main macronutrient your stomach works on?
Protein.
Protein. Keep that in mind. Keep that in mind. Okay, so some cells, a little bit, nothing too crazy, I promise, but parietal cells. Your parietal cells, they make your hydrochloric acid and intrinsic factor. Okay, your chief cells. I think of chief kind of like chef. Your chef cells, they make pepsinogen, i.e. the chef breaks down proteins. Okay, and again, pepsinogen turns into pepsin because of hydrochloric acid. Now, the G cells, not to be confused with your G units or your G6s or your G7s or your OGs, but you're just G cells, okay? These are located at the fundus. Two important hormones, gastrin. This is going to stimulate hydrochloric acid release and production. Okay. So this is when you are thinking of that beautifully toasted bacon breakfast burrito with the eggs, the cheese, the potatoes. Just thinking about that delicious goodness. When you're thinking about food, that causes you to release gastrin. Why? What's the goal of gastrin here?
Stimulates hunger.
Nice. It's going to be dealing with hunger. Absolutely. This is going to prep the stomach for food. Okay. Ghrelin. Ghrelin. What sound does your stomach make when you're hungry? Ghrelin. See what I did there? Ghrelin, this causes the muscle spasms of the stomach. Okay, and it's a reminder that you're hungry. Okay. So both of those, gastrin and ghrelin, they're released during times of hunger. There's another hormone that we're not going to really talk about called leptin. Leptin is a hormone that causes you to feel full. Okay. Fun fact, does anybody know how long it takes for these hormones to go to your brain after coming from your G cells? 20 minutes. So basically, it's 20 minutes before you realize that you are full. Fun fact, if anybody wants to get into competitive food eating. So here, all I'm saying is that your stomach is under parasymp control. So if I activate my parasympathetic nervous system, what would that do to acid production? Increase or decrease? Increase, because that's part of rest and digest. Absolutely. Okay, so if you activate your parasympathetic nervous system, you'll increase hydrochloric acid, you'll increase peristalsis, etc. Okay. So let's kind of get into this question here. So a 62-year-old female has stomach cancer and she has to have her entire stomach removed. Yes, this is an actual procedure. She has her entire stomach removed. Question is, which macronutrient is affected? Which macronutrient can she no longer digest?
Protein.
Proteins. Do you need proteins to live? Okay, I agree. You need proteins to live. Absolutely, especially to heal after surgery. She can't eat proteins. What do we do? This is the critical thing of thinking of a nurse. You have a patient with needs. This patient has problems. Maybe IV nutrition. What would you give her IV? You can't just dump
What's
protein.
called TPN.
Yeah, TPN, yeah.
We might be able to do TPN, sure. Does anybody know how expensive that is?
extremely, and it doesn't last very long because of long-term complications.
Exactly. So we could do TPN, we could do IV nutrition, but hey, is this woman going to need proteins later in life too? Yeah. What do we do?
Don't they create a pouch out of like the small intestine? Or am I wrong?
You're thinking of like gastric bypass? Kind of. There's an even easier way. So let's think about this. What are proteins made of? What are proteins made of?
Amino acids.
Amino acids. So if you break down proteins, you get an amino acid. Your stomach breaks down proteins and you get amino acids. So instead of giving her a steak, what could I give her instead?
Broken down amino acids.
Yeah, broken down proteins, i.e. amino acids. You give amino acids. Again, your stomach. What is the one job of your stomach?
Churn food and make it chyme and break
Mhm.
down proteins.
Break down proteins. That's the biggest thing. Your stomach's job is to break down proteins. This woman here, no stomach, can't break down proteins. So what do? We break them down for her. We just give her amino acids. Do we absorb proteins at the stomach? No, we only break things down. Another question for you. Patient again has her whole stomach removed. Could you give her a stick of butter? Could she, if she got so willing, if she wanted to eat an entire stick of butter, could she?
No, because it's not, she doesn't have her stomach to secrete the enzymes to break it down.
What butter's made of fats? What enzymes does the stomach make to break down fats?
Salivary lipase.
That's your mouth.
Oh, that's right. I don't know.
She could, because she'd break it down in her mouth.
Well, she would mix it in her mouth. Remember, salivary lipase doesn't actually break down fats. So what I'm getting at here is, could she eat a stick of butter? What happens to butter in the mouth? It mixes. Does it get broken down? Okay. What happens to butter in the esophagus? Nothing. What happens to butter in the stomach? Technically nothing. There's no enzymes, there's no secretions that interact with fats. So despite this woman not having a stomach, could she eat a stick of butter? Yeah. What about a sugar cube? Can I give this woman a sugar cube? Yes. Why? Where does sugar first start getting broken down? Salivary amylase in the mouth. Okay. So this is kind of nutrition in a nutshell. You need to know kind of this whole system, okay, from mouth to butthole, but then what does each organ do? Mouth breaks down sugars. That's why you have a digestion column. Esophagus, don't do anything. Stomach breaks down proteins, doesn't do anything to carbs, doesn't do anything to fats. Make sense? Okay. So what is the last macronutrient to be digested in the human body? What is the last macronutrient to be broken down?
Fats.
Fats. Carbs start at the mouth. Proteins start in the stomach. You haven't even talked about fats yet. Okay.
So is protein then just digested in the stomach, not absorbed?
Exactly. It's only digested. It's only broken down. Very good. Okay. Cool. So let's take a wee little break here. What do you say? 13:45, we'll pick back up again. Okay. Great questions, y'all. Let me know if you need me to go back to a different slide or if there's any other curiosities going around. Oof. I gotta ask though, Kelly, was that on a dog, cat, tarantula?
So it was my own fault. I was giving a dog sub-Q fluids and I was like completely done, but I was trying to take the needle off of the end of the IV line to dispose of it. Instead of the needle coming off, the cap came off, and then I like
Did you
was
try to
pushing,
recap it?
so I pushed it right into my finger.
Oof. So it turns out you got some extra fluids too.
Yeah.
Ouch. All right, so now we are in the lower half with the GI tract. We got our small intestines here. Okay, give or take 5 to 6 meters long. You don't need to know that number. It's about give or take, what is that? 12 to 20. I think it's 12 to 20. 12 to 20 feet. Again, you don't need to know these numbers. I'm just trying to make a point here. Your entire GI tract is give or take about 32 feet. So when it comes to your entire GI tract, if 12 to 20 feet of it is your small intestines, oh Lord, small intestines make up most of the GI tract. Okay, so from mouth to butthole, it is mostly small intestines. Okay, and what is the single job of your small intestines?
Absorb nutrients.
Exactly, to absorb, absolutely. There are 3 segments to the intestines that you need to know: the duodenum or duodenum, jejunum, and ileum. This is the way I remember it. DJ ill drops the sickest beats. What up? Sorry, when I was learning it, I was kind of in my electronic phase at the time, so it just kind of clicked. But the duodenum or duodenum, this is the first 10 inches, so the very first segment. This is the mixing hub. This is where all of your accessory organs kind of interface. Okay, so your liver, your gallbladder, your pancreas all connect to your main GI tract through the duodenum. Okay. Then you have the jejunum and the ileum, and their job exactly is to absorb so many things. Okay. Your ileocecal valve, this is connection between your small to your large intestines. Okay. Then the peritoneum, that's your serous membrane that surrounds the GI tract. Okay. Right. So your small intestines are lined with villi. These are kind of finger-like projections. Okay, their whole goal is to increase surface area. So you got these like little fingers lining your entire small intestines. Those are your villi. On top of your villi, you have more little microvilli. So again, the whole goal here is to increase surface area. Okay, fun fact, if we were to take out your small intestines and cut it so it lays flat, okay, then we squish down all of the villi, and then we squish down all of the microvilli. Inside of you right now, you have the surface area of a tennis court. You have the entire surface area of a tennis court, all for absorption. This is why when I eat a 12-pack of donuts, it really kind of sticks with me for a while. Okay. Now, all of your microvilli and your villi are stacked together. They make this brush border. One of the things we see at the brush border is an enzyme intrinsic factor. Okay. Again, what is intrinsic factor all about? What's that do?
B12 absorption.
B12 absorption. So going back to that patient that we had, the patient who had her entire stomach removed, would she be at risk for pernicious anemia? She might be, but not likely, because her small intestines can absorb B12 as well. Okay. So inside of your villi, you have a blood vessel. Inside of your villi, you have this blood vessel. Now, what macronutrients can I dump into my blood? What macronutrients can I absorb into my blood?
Carbs, glucose.
Carbs, I agree. What else can I put into my blood?
Lipids.
Do I want to put fat into my blood? Close. What's the other one?
Protein.
Nice. Proteins, okay. But for those lipids, you have a lacteal. That's for your lipid absorption. This is that third function of the lymphatic system we were talking about, moving lipid soluble things. Okay. So your mouth breaks down carbs, your stomach breaks down proteins. Where do we break down lipids?
The duodenum. Well,
At the duodenum, that mixing hub, because we need to break it down before we absorb it at the jejunum and the ileum. Very good. Okay. So just kind of highlighting here, this is what we were talking about. This is your villi with the microvilli. You got your capillary bed and your lacteal. Okay. So again, carbs, they start at the mouth. Proteins, they start at the stomach. This right here is your duodenum. That's your mixing hub. That's the first 10 inches where your pancreas, your liver, your gallbladder interact. So at your duodenum, oh, oops. You see lipid breakdown start at your duodenum. Okay. Ooh. Okay. So now we're going to be talking a little bit about the enzymes of your accessory organs. So your pancreas, again, because I'm particular, you can't just say amylase. You need to say pancreatic. Pancreatic amylase. What does pancreatic amylase do? What does pancreatic amylase, what does it do?
Further breaks down carbs at the duodenum.
Perfect. carb breakdown or digestion at the duodenum. We're going to skip trypsinogen and chymotrypsinogen. We're going to skip nucleases. I promise to explain at the very end, but we're going to say zymogens. Zymogens is a category of enzymes. Its job is to break down proteins. Last one here, pancreatic lipase. No tricks, I promise. According to the Latin, what does pancreatic lipase do? Fat breakdown or digestion, either one, at the duodenum. Okay, so if you're noticing, all three macronutrients are being broken down at the duodenum because of which organ? Which organ allows me to break down all three macros?
Pancreas.
The pancreas, absolutely, okay. Carbs started in my mouth, they finish in my duodenum. Fats, they start and end at my duodenum. Zymogens start in my stomach and end at my duodenum. Okay. Bile salts. Bile salts, these are the active ingredient to bile. Okay. So why are we talking about bile salts? So let's talk about absorbing fats.
And the bile salts are still in the small intestine, right?
Correct. They're secreted into the duodenum. I should specify made at the liver, secreted at the duodenum. Yeah, sorry about that. Thank you for that. Okay. So if you want to absorb fats, what do you need to do to those fats first? If you want to absorb fats, what do you need to do to those fats first?
Mix them.
Yep, so you guys actually both nailed it. In order to absorb it, you have to break it down first. Okay, but in order to break down fats, you have to emulsify them first. Okay, so fats, you have to mix it before you break it down, before you can absorb it. Proteins, do proteins need to be emulsified? No, you just break down proteins, you absorb proteins. Carbs, do you need to emulsify carbs? No. Fats has one extra step. We need to emulsify it. Okay, so like fun fact, talking from a nutrition standpoint, fats are the hardest thing to digest, therefore the hardest thing to absorb. Okay. So your intestines, their job is to absorb everything. Absorb everything. Okay. Now, this is a nice table for absorption. Table of absorption. Okay. So here are things that we absorb by organ. We're going to modify this list a little bit, but yes, you do need to know this list. Okay. Your stomach can absorb water, alcohol, and what else that you guys know about? What else can your stomach absorb? Think about the secretions.
Proteins or carbs?
Not carbs, not proteins, not fats.
Both.
It's a vitamin.
Vitamin K?
Oh,
B12. Vitamin K will come a little bit later. Actually, like you're like 2 slides ahead of me. Hang tight on that. So stomach can absorb water, alcohol, B12, caffeine, and aspirin. The aspirin part will play a role in pharm, but that's why you can give yourself an ulcer from too much aspirin. So water, alcohol, the drinking kind, not the rubbing kind, B12, caffeine, aspirin. Okay. Those are the 5 things that are absorbed at the stomach. Again, remember, no macros. We only break down proteins there. Difference between digestion and absorption. Duodenum, I want you to remember that it's the mixing hub. So do not worry about absorption there. Big takeaway point about the duodenum is that it is the mixing hub. Okay. Jejunum absorbs sugars, i.e. carbs, proteins, and what other macronutrient?
Fat?
Fats. Lipids, perfect. Ileum absorbs bile salts. B12, and don't worry about chloride. Bile salts. Well, that's weird. Because before we were talking about biosalts, right? Bile salts right here. Bile salts are secreted into the duodenum. So you secrete bile salts up here, they travel all along, they get to the ileum and they're reabsorbed. This brings up the idea of bile salt recycling, where it is made at the liver, secreted at the duodenum, but reabsorbed at the ileum. Bile salts made at the liver, they are secreted into the duodenum to emulsify fats, but then we reabsorb them at the ileum. Okay. This idea of bile salt recycling is going to play a role a little bit later in pathos regarding gallstones. So just hinting at something there. Okay. And then the colon, water and electrolytes, pretty straightforward. The whole point of the colon, dehydrate your poop. Okay. So your large intestines, these are the different structures here. Your ileocecal valve, again, this is connecting the small to the large intestines. Okay. Your appendix, what does your appendix do?
nothing.
Nothing. Well, that's the common idea here. So you don't need to write this down. How did we arrive at this answer? So I forgot what the name was, but there was a zoologist. What he did was, I imagine he went to a zoo. This zoologist went to the zoo. Sorry, Kelly, this is a little bit gruesome. He cut out the appendix, I believe, out of 19 different animals. None of them died. Therefore, your appendix does nothing. Turns out that idea has kind of, I don't know, pervade for so long, but now we're finding out that it's wrong. Your appendix actually has a very, very important role. Your appendix stores backup copies of your gut biota. Your appendix actually stores backup copies of the bacteria that live in your colon. Okay, let's do a little bit of a refresher. Why do we like the bacteria in our colon? Why is it good to have bacteria in our colon? What do they do for us?
No C. diff.
Yeah, they help fight C. diff. Absolutely. We'll tie that into patho there. What do
They
the
can break
bacteria?
down things that the rest of your gut can't.
Yeah, they can break down things that the rest of my gut can't. Therefore, that's why I fart and poop more violently after eating Taco Bell. Absolutely.
Vitamin K.
Yes. Your bacteria, they poop out vitamin K. And what do we use vitamin K for? Vitamin K is the precursor to
Coagulation.
Yes, it leads to coagulation.
Prothrombin.
Prothrombin. So backing up, the bacteria in your colon, they poop out vitamin K. This little bacterial poop, you convert into prothrombin. That allows you to clot. Your appendix stores backup copies, okay? So let's say for whatever reason, I need to go on antibiotics. I take antibiotics for 6 months. What does that do to the bacteria in my gut?
Kills them.
What happens to vitamin K then? What happens to the ability to clot my blood? It's a weird kind of pathway, but it's something that, again, this is one of the reasons why we don't prescribe antibiotics for a long period of time. Somebody who takes antibiotics for too long, they can lose the ability to clot their blood. But if I'm on antibiotics for a long time, my appendix, it will release a couple copies of this bacteria back into my gut to help reseed my gut, to bring back that bacterial growth. I think, Reese, you brought up C. diff. C. diff is a bacterial infection. So when the bacteria grows out of control, the bacteria in my appendix creates a competitive market, like we talked about in the skin, in your colon. Okay. So what I'm trying to get at here is your appendix actually has a very, very important role. Okay. Well, I'm kind of hinting at more stuff coming down the line here, but it's what you need to know right now is your appendix actually stores copies of your gut biota to help you clot your blood. Okay. Now your colon, that's the main part of the large intestines, 4 sections. You have the ascending, transverse, descending, and then the sigmoid. Up, over, down, and around. Okay. And then again, I am not touching the rectum or the anus 9-foot pole. That is your business. So here we go. Here is your colon. So starting off with, here we go, the ileocecal valve. Again, that connects your small to your large. Okay. Oh, sorry, guys. Sorry. Going back up. I forgot one structure. The cecum. The cecum. Sorry. Cecum is the pouch. Okay. Is the pouch before the ileocecal valve. Okay. The cecum is the pouch before the ileocecal valve. So your ileocecal valve is right there. This is your cecum. It's this pouch back here. Hanging off of your cecum is your appendix. Okay. So your appendix Remember I told you it has backup copies of bacteria in there? We send macrophages down there. We send your adaptive T and B cells down to the appendix to train to learn how to kill things. But let's say again, you have some terrible Taco Bell and there's a piece of poop right here. If there's a piece of poop blocking that, we can't clean out the bacteria. We can't trim down the population. That's why your appendix becomes inflamed. That's why your appendix can rupture. We'll talk about appendicitis, but just it's easier when you have a picture in front of you. Okay. But assuming that everything is fine, here is your ascending, transverse, descending sigmoid. Okay. And again, what is the whole job of the large intestines?
Water absorption.
Nice, water absorption. I say dehydrate your poop, but yeah, absolutely. Okay. So, fun little case study here. This is an actual patient's x-ray. This patient, one of my good friends, he is a paramedic. He managed to obtain this x-ray for me. Okay, so this patient has a severe obstruction. Can anybody identify what structures are being obstructed or what structures are being affected? And no. Get your heads out of the gutter. This is not the patient's member. That is the obstruction. So what part of the colon is blocked? What part of the colon is backed up?
Ascending?
We got ascending. Anyone else want to throw it down?
Sigmoid.
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 Sigmoid. No descending, huh? Okay, so taking a look at this here. This obstruction is actually pretty medial to the body. So looking at this picture here, structures that are medial to the body. Ascending is actually kind of lateral. It's kind of a little bit further to the, in this case, right. Descending is a little bit left. The only quote unquote middle or medial structure is the sigmoid. So in fact, that is blocking the sigmoid colon. Can anybody identify what the obstruction is?
Is it feces?
I wish.
Don't tell me that's like a vibrator.
There's a reason why I drew it in pink. Happy Tuesday, everybody. Here we are at week 7, full circle. So if you want to live the glorious life of an ER nurse, this is what you can kind of expect. Sex accidents are a thing, okay? Now, patients will come in, they'll have some crazy stories like, oh, it was at the bottom of the stairs and my roommate pushed me, or it was sitting next to my chair and my chair broke. Yeah, you get some crazy stories and they're very creative. Now, the reason why I'm bringing this one up, this patient was completely nonchalant about the whole thing, which I really kind of respect. My friend who's a paramedic, he's seen everything. He rolls up to scene and he's like, so why'd you call 911? He's like, well, you see, I met a girl on Tinder. We had some fun. No, sorry, it wasn't Tinder. It was Craigslist. Met a girl on Craigslist, had some fun, and I haven't been able to poop for 2 days now. So, yeah. I don't know. People are funny. I've heard of like the mysterious hamster. Like I heard it as a myth. That's crazy that it's confirmed. Yeah, exactly, Kendall. He kept it in for 2 days and he thought, oh, I haven't been able to poop yet. Okay. Now, when you guys do get into x-rays, you have to understand landmarks. Okay. This right here is the patient's lumbar vertebrae. Anybody have an idea of how big your lumbar vertebrae is? It's a little bit bigger than that of a soda can. So, moral of the story here. There's a fine line between bravery and stupidity. The key to life, make sure you know which side you're on. Happy Tuesday, everyone. Oh, I didn't know you could disassemble hairspray cans. Oh man, I'll tell you guys a story. It's a Darwin Award that's very similar to that. I'll tell you guys over break because that's funny. Like the ingenuity that these people express blows my mind. All right, so talking about the bacteria, okay? So we talked about the bacteria, so your gut biota, they make, actually, I don't know why I drew an arrow. Sorry, your gut biota, they make vitamin K. And we use vitamin K and turn it into prothrombin. Anybody remember where? Where do we convert vitamin K into prothrombin?
Liver?
Yeah, nice. At the liver. Okay. The stomach is relatively sterile because of your stomach acid, which kind of makes sense. Okay. Your stomach acid breaks down everything, bacteria, food, anything. The bacteria that kind of live in your large intestines are typically anaerobic, which means what? Something is anaerobic.
It doesn't require ATP
Well, the carb 98K for
or
brain
energy.
is supposed to be.
There you go. So it kind of goes with ATP. No require oxygen. They make ATP differently. They just burn straight up glucose instead of using fats with a Krebs cycle. Okay. Now, the bacteria in your gut, we kind of mentioned, helps you clot your liver or clot your blood. Fun fact, but I honestly think that this is the future of medicine. We are starting to find out that the bacteria in your gut actually influence the amount and the sensitivity of neurotransmitters secreted into your brain. What I'm getting at is your diet can affect the way you mentally feel. We're seeing studies where people with depression, people with anxiety, typically have a low diversity in their gut. People that are quote unquote healthy, they have a high diversity in their gut. Okay. Agreed, Lita. I'm right there with you. We're going to take this even a step further. I personally worked with a gentleman who was looking at gut biota as a vaccine. Can you imagine if these little bacteria in your gut influence how your brain functions? What if I could give you the gut biota of someone quote unquote healthy, somebody with healthy mental health habits? What if I can prevent things like PTSD? What if I could inoculate someone against depression? I honestly think that's where the future of medicine is headed. It is very fascinating research, and I honestly think this has some crazy implications for you guys as future nurses. So just fun fact, but yeah, your appendix holds all of these bacteria. All right. So we'll take a little pause here before we get into the accessory organs. We'll say like, I don't know, 2:30, we'll pick back up again. Okay. If anybody's interested, I'll tell you guys that Darwin Award, Lita, it's very similar to your story there. There was a Darwin Award. This person was driving in the desert stupid fast because it's the desert. Who else is in the desert, right? They ended up flying super fast and they pop a tire. Oh shit. So they're pulled over to the side of the road. A sheriff starts coming down the road. Now they see that this person's pulled over and they have a flat tire. So they pull up behind the person to help change their tire. What the sheriff didn't know, the person had 5 pounds of cocaine in their cup holder. This person sees the sheriff roll up behind him, wave him down, runs to the driver's side of the truck or car and begins to eat this cocaine. I don't know how much this person ate, but this person ate so much cocaine that they began to asphyxiate, began to choke, because it's the middle of the desert. By the time the ambulance got there, the patient died. So that's the Darwin Award. Again, the cop had like no idea what was going on. It's just like, dude, I just came over to help you with your tire. So that was one of my favorite Darwin Awards.
Have you ever seen that Cheech and Chong movie?
No, I can't say I have. Sorry.
So do you know who Cheech and Chong are?
Of course, of course.
Okay, so there's this movie that they have, and obviously they're stoned out of their minds in a car, and they're on the side of the road, and Cheech goes, "Hey man, how's my driving?" And the other dude goes, "I think we're parked." And so a cop pulls up behind them, and Chong has like 1,000,001 tabs of acid on him, and he just starts eating all of them and trips for like a week or more. But that's just what that story reminded me of, was that
Oh
scene
my
in
gosh.
Cheech and Chong.
Absolutely.
And this is like totally not the anus or the rectum, but we have a frequent flyer at my work that comes in all the time because he shoves stuff up his pee hole.
Yeah, they're all coming in now.
Like it's like his, I don't know, it's like his, what he does to get freaky, I guess, but he's had thumbtacks, he put a pen in there, like a ink pen, and then when he pulled it out, just the tube came out and the like ink part stayed in. He's done bobby
Did you drop a
pins.
Swiss or no?
He's never had to have them surgically removed. He like just gets them dug
I'll
out.
keep
But
using my
Man, y'all just, people are crazy, and this is the field you're stepping into.
I also have a frequent flyer that like he's an in and out prisoner because there's a prison under the hospital we work at. And he routinely eats like razor blades, pencils, screws, you name it, he eats it.
That's
And we've
crazy.
scoped him 50 times in the last year. Like if we leave an IV on him, he'll pull it out and he'll eat it.
I hear
Crazy.
that that's like, there's a mental disorder. I believe there was some French guy, and Queenie, this kind of reminds me of that story. This French guy just had like a hankering for non-edible objects, would eat light bulbs and metal. And at one point he ate an entire plane, like bolts, carbon fiber, wires and all. People
It's
are
like
crazy.
that show, My Strange Addiction.
yeah, it's called
yeah.
pica. They like eat weird stuff. We've had
Yeah, pica.
people come in with like what are they
Ooh,
called?
trophy too.
Bowel obstructions because they eat like toilet paper and paper towel and like stuff they just can't.
Hair
digest.
is a big one.
Ew. Yeah.
This patient, we've screened him for that, and he doesn't have it. He just does it to get out of the prison because he knows that he'll get some good drugs. It's pretty sad.
Wow. Damn, that's a dark place. Phew. All right, well, I am not going to go eat a razor blade, but I am going to get more water. So I will be right back. Reese, was that you who asked about C. diff? I don't know if you're back or not, but I forgot who asked about C. diff.
I had just
Yeah.
mentioned that when if you lose like most of the bacteria in your stomach due to an antibiotic, that C. diff grows faster. So then you basically just poop out liquid fire.
Yeah, that's actually a great way to describe it, is liquid fire. Hot magma. But yeah, with C. diff, the issue is the bacterial balance is out of control and the bacteria is just raging inside your colon. And C. diff is the type of bacteria that causes all those problems. One of the interesting treatments that kind of deals with what we were talking about is they will reseed somebody's gut. So you guys have heard of poop transplants? The idea is I'm going to take poop from one person and put it in another person, because now I'm introducing other bacteria. They're going to be too busy fighting rather than infect you. There is, oh, nice. There's actually an oral pill, an oral capsule form of the poop transplant, where the poop is inside of a pill. Does anybody know what the name brand of that pill is? It's called the Crapsule. Like, they saw their shot and they took it. I respect that. Yeah, it's actually kind of interesting, the whole harvesting process. It's not as straightforward as you think it would be. It's encapsulated, you'd be fine. It's not like you can taste it.
I kind of wish this would happen more often. I like remember having a patient that was like bedbound or like couldn't get up, kind of incontinent. It literally like burned their scrotum. It was so bad.
Oh, absolutely. The bacteria is just so caustic, and the byproducts it makes is just, it's sad. It's sad. So I really, and that's something that's thankfully catching on, but I agree. I wish it was a little bit more prevalent, to say the least. Yeah. All right. So jumping into your accessory organs, starting off with the liver. Your liver, its job is to make bile. Okay. Your gallbladder, its job is to store the bile. And the third accessory organ is your pancreas. Now, if you guys remember, your pancreas secreted things like pancreatic amylase, pancreatic lipase, zymogens. What macronutrients did your pancreas break down?
All of them?
Yes, pancreas breaks down everything. You got it. Absolutely, and that's exactly how I describe it. It does everything. It breaks everything down. It doesn't absorb anything, okay? So this is why we call them the accessory organs. Notice again, if this is food goes through your esophagus, it sits in your stomach, goes through your duodenum, and then into the rest of your intestines. Your accessory organs sit outside of your main GI tract. Therefore, does that Twinkie I ate pass through my liver? No. Does it pass through my pancreas? No. Does it pass through my gallbladder? No. No food directly passes through these accessory organs. Okay. They attach to the main GI tract, but they are not a part of the main GI tract. And no, I did not actually eat a Twinkie. Don't judge me. Although you probably would believe that I ate one. All right. So this little blue sac down here, that is your gallbladder. Okay. Again, just really want to emphasize this is your duodenum, 10 inches, mixing hub. Okay. This is your hepatic portal system. Hepatic portal system. Okay. So if you notice, here are all your organs, your stomach, your large intestines, your small intestines, they're all connected by veins. Okay. when you eat something and it goes into, for example, your small intestines, it gets absorbed by these veins in the villi and then transported up to the liver. Okay. So your hepatic portal system collects nutrient-rich blood from each organ. At this point, it has to decide what to do with each nutrient. It decides what to do with each nutrient, i.e., do we store it? Do I circulate it? Or do I dispose of it? Okay. So your liver decides, do you store those extra carbs? Do you send that glucose into the blood to fuel your brain? Or do you get rid of it, i.e., do you make it poop? Okay. So your hepatic portal system collects blood from all your organs, sends it to your liver, and then your liver decides what to do with all of it. Okay. So, talking about your liver, a couple different structures here. Your hepatocytes, HEPA. You guys ever hear of like filters? They have that HEPA rating. HEPA translates to filter. So your hepatocytes, these are your filter cells. Makes sense. You guys know your liver is a great filter. Okay. Sinusoids, you'll see a picture. Kupffer cells. Kupffer cells, they line the sinusoids, and they're going to phagocytize debris, microorganisms, etc. Okay, their job is basically to clean your blood. Notice they are phagocytes, they phagocytize things. Therefore, what kind of cells are Kupffer cells? i.e., what system do they belong to? Nice. These are immunologic. Nice. Then you have your common bile duct. Common bile duct. This is going to connect the liver, gallbladder, and duodenum. Okay. So here's a nice little picture of your hepatocytes, these little filter units. Okay. Do you guys see this capillary here where you have oxygenated blood mixing with deoxygenated blood? Okay. That's your sinusoids. Sinusoids. This is where we mix deoxy with oxy blood. Okay. So it's kind of like these structures right here. Inside of those little black dots here, those are your Kupffer cells. Okay. That's how we, quote unquote, clean our blood. Does that kind of make sense in terms of organization?
So the Kupffer cells are within the sinusoids?
Correct.
Okay.
Correct. Kupffer cells. Let me put that in parentheses. Inside the sinusoids. Mhm. All right. So bile. Thankfully, we have kind of talked about bile. Does anybody remember what is the main job of bile? What does that do? What's the purpose for us here? Nice, yeah. Main job of bile, emulsify fats. Emulsify fats where? Where do I secrete bile? Let alone bile salts.
Duodenum.
Yeah, the duodenum. Nice. Nice work. Okay. So bile is kind of like a soup. It's a mixture of things. Main ingredient, active ingredient, bile salts. Remember, we recycle those. We secrete bile into the duodenum, but we reabsorb the bile salts at the ileum. You also see cholesterol, bilirubin, electrolytes, and jaundice. Okay. You guys know about bilirubin. It's a byproduct of destroyed red blood cells. You knew about that already. So in theory, if I have decreased liver function, what happens to bile production? More or less? Less bile production. So if I'm making less bile, guess what's building up? Increased bilirubin. That's what leads to your jaundice. Okay. So that's how your liver, when your liver's compromised, they can lead to jaundice. Cool, cool. What else would increase maybe as a result of liver dysfunction? Look at the components of bile. What else would what else would increase?
Or do you have edema?
You might have edema because of increased water. Nice. What else could happen? Hey, would you guys have that free response, 7 steps, something about that? Definitely electrolyte imbalance. Yeah, yeah. What was that thing with the 7 steps with it ends in a complicated plaque?
Atherosclerosis.
Why could I could have atherosclerosis? Yeah, because of increased cholesterol. I'm kind of showing you guys a hint here. Your liver goes down, a lot of bad things are going to happen. Here's just 5. We've talked about 4 other things at the very least. So, functions of the liver. To date, your liver has over 200 different functions, over 200 different functions. Your liver is really important, okay? No, I'm not going to make you know 200 different functions, but these 7, you should actually kind of already know. Okay, so starting with blood storage. Your liver stores blood in conjunction with what other organ?
The spleen.
Nice. Spleen. Bacteria and foreign particle removal. Who or what inside the liver removes bacteria and foreign particles?
Eosinophils.
Almost.
Kupffer cells.
Kupffer cells. Plasma proteins. What is the most important plasma protein? Provides the capillary oncotic pressure.
Albumin.
Albumin. Clotting factors. Hey, kind of important for the intrinsic, extrinsic, common classical cascade, right? Bile. Again, what is the main purpose of bile?
Fat absorption.
Before fat absorption.
Emulsify fats.
Yeah, correct. Emulsify fats. So that way we can digest those fats. That way we can absorb those fats. Absolutely. Metabolizes fats, proteins, carbs. That's because of your hepatic portal system. Detoxification of metabolite products and waste. That's your Kupffer cells again. Oop, spelled that wrong. Kupffer cells. Storage of minerals and vitamins. And important, so you store a bunch of different minerals in your liver, but one of the important ones, iron. Vitamins, we're going to talk more about with pathos. A, D, E, and K. ADEC. A, D, E, and K. So let's hypothesize here. Let's say somebody has liver cirrhosis. What kind of symptoms can they look forward to? We have these four up here, or these three, but what other symptoms can we look forward to with liver cirrhosis? Starting with number one. If I store less blood, what does that put me at risk for?
Anemia.
Yeah. I did not spell that right. E. Oh, I put an extra. Okay. Bacteria and foreign particle removal. What happens if you don't remove bacteria out of your blood? What does that set you up for?
Sepsis.
Oh, God. Oh, my God. What happens if I have less albumin in my blood?
You're bleeding out.
That's the clotting factors. So I'm going to say bleeding, sure. But what about albumin?
Edema.
Oh, yes. Less bile. Hey, we talked about it up top. Athero, jaundice, more edema. Proteins, fats, carbohydrates. So we're looking at malnutrition. Still looking at sepsis. Huh, I can store less iron. What does that set me up for?
Iron deficient anemia.
Iron deficiency. Oh God. Deficiency anemia. Okay. We haven't talked about the vitamins yet, but there's actually one vitamin I do want to highlight. B12. So what other anemia am I at risk for with my liver becoming cirrhosed?
Pernicious anemia.
Pernicious anemia. Okay, are you guys kind of seeing something here? i.e., do you see how the liver is the central point for not only this unit, but oh, so many other topics that we've talked about before. Okay, by the end of this, by the end of, I would say next week's lecture, the GI Patho, you should be able to come up with like 30 different issues. Let me say not different, but you should come up with 30 issues. So take, for example, we have edema here twice, but for 2 different reasons. Personally, I was digging around, just trying to see what I could come up with. I think I came up with like 45. So it's not unreasonable for you guys to come up with 30. Your liver is super important. And we're going to talk more about it in GI Patho. This is not the end of it. But again, do you guys see what I'm talking about? Like, do not underestimate that liver. Okay. Right. So next up is your gallbladder. This one's a little bit simpler. Function of the gallbladder is to store and concentrate the bile. Wow. Easy enough. Can you live without a gallbladder? Yes. No gallbladder? No problem. We just connect the liver directly to the duodenum. Okay. So if you have no gallbladder, we reconnect the liver just to drip bile consistently. Okay, so that's the whole point of the gallbladder. Your gallbladder stores this bile. So if I bite something very fatty, very umami, I need a lot of bile. I need to push a lot of bile because it's a lot of fat. Somebody who doesn't have a gallbladder, they can't take in a lot of fat at once. They can take in fat, but a double bacon cheeseburger might be pushing it. Okay, so they just kind of like portion it. Yeah, absolutely. Low fat diet. All right. Your pancreas secretes enzymes. Yes, it does. And we talked about it, but also secretes alkaline fluids. Main thing is bicarbonate. A little bit of an anatomy question here. Why? Why does your pancreas need to secrete bicarbonate?
To neutralize the HCl out of the stomach.
Nice. Neutralize stomach acid, or in this case, hydrochloric acid. Neutralize stomach acid. I'm going to scroll back up after you guys write this down. I'll scroll back up so you can kind of see a picture of it. Okay. Cool. So in this picture here, in red, that's your hydrochloric acid. Red is hydrochloric acid, okay? What protects the stomach from breaking itself down? What protects the stomach from breaking itself down? Mucus. Do I secrete mucus at my duodenum? No. I need to protect my duodenum, else I'm going to break down my duodenum. This is when your pancreas comes in and secretes that bicarbonate. Ooh, that color does not turn out well. That's when my pancreas comes in with the bicarbonate to neutralize that acid. You guys hopefully see that now. Okay. Okay. So your pancreas is the only organ with, so then what if, great question. Other bad issues. But basically it could be, you can't neutralize stomach acid, so we might have to take out your stomach. We might put you on acid pump inhibitors. Lots of macronutrient issues you'll see here in a little bit, but basically, if you have pancreatic issues, like example, pancreatic cancer, it's kind of a death sentence. Okay. Your pancreas has both exocrine secretions and endocrine secretions. So understand that your pancreas is the only organ that can secrete both inside and outside of your body. It's the only organ that has both inside and outside secretions. So what are some exosecretions that we have talked about that comes from your pancreas? What are some exocrine secretions that come from your pancreas? And we've actually talked about 4 of them.
Pancreatic amylase.
Pancreatic amylase. Pancreatic lipase. Zymogens. Bicarbonate. All of these things, these 4 things we use for the GI tract. Why are we secreting these things to the outside of our body? That's weird. Why are we secreting these things outside of our body?
To break down stuff to bring it in.
Kind of.
The GI tract is the outside of our body.
The GI tract is the outside of the body. Correct. Remember again, your GI tract is external. Your GI tract is technically the outside of your body. Endocrine secretions, these are going to be hormones. Oh, it is extremely weird to think that we are hollow tubes of meat. Absolutely. Hormones that we'll talk about later at the end of the quarter, we're talking about like insulin. Okay. Again, we'll talk about that at the end of the quarter. I'm not going to test you on it now. Big thing is going to be on the left there in red, the exocrine secretions. Okay, so recapping here, goes by pretty fast. Bicarbonate, neutralize the hydrochloric acid from the stomach. Zymogens, this is again a family of enzymes, none of which you need to know individually. Trypsinogen, chymotrypsinogen sits in there. Zymogens break down proteins. Break down proteins. Okay. Pancreatic amylase. Break down carbs. Pancreatic lipase. Break down lipids. That is why I'm so particular. Pancreatic lipase breaks down lipids. Where else have we seen lipase in the body?
The mouth.
The mouth with salivary lipase. Now, does salivary lipase break down lipids? No, it only emulsifies. Again, that's why I'm particular. Need to add the gland next to it, okay? Nucleases, that's for DNA. We're just going to add that to zymogens. Good enough. Okay. Another fun ER story. I have so many questions with this picture. Is Lita? Yeah, Lita's still here. First off, why feet first? Like, of all things. Then I don't know if you guys noticed, but take a look at the wings. Something happened and one of those buttons got pushed and those wings are trying to deploy. Yikes. All right, so you guys remember when I told you you know, I admire your perseverance. All right, so you remember when I told you guys at the very beginning, I would probably create a table of sorts. This is just an example. We're not going to run through the entire thing, but this is just to kind of help give you an idea of what you should be building towards. Okay, so organs going from the top to the bottom. You got the mouth, the esophagus, stomach, your small intestines, duodenum. Oh, nope. Jejunum, ileum, large intestines, liver, gallbladder, pancreas. Okay, so those again are the organs that you are responsible for. I didn't create a column for the relevant structures. You should probably do that. Okay. Now, take for example, the mouth. What is an enzyme? Anybody list anything? What is an enzyme or a secretion that comes from the mouth?
Lipase.
Yeah. Salivary lipase. Salivary amylase. Water bicarbonate. So again, I did this in one column. That's just the way my mind organized things. You can separate digestion and absorption into two if you want. What macronutrient is digested in the mouth? What's broken down in the mouth?
Carbs.
Carbs, nice. Now, what do we absorb at the mouth?
Nothing.
In terms of macros, but there was that list that had all of the organs there. Alcohol, caffeine. There's 5: alcohol, caffeine. Those are the two.
I thought you said that was at the stomach, was the alcohol and caffeine.
Oh, you're right. It is. I'm blanking. Oh my gosh. I am so sorry. Kelly, you had it. You should have been more assertive. Damn it. Thank you, Tara. Sorry, Kelly. Yeah, you're right. You guys are right. Nothing's absorbed at the mouth. Yeah. Okay. What about the esophagus? This one I can do. What do we secrete at the esophagus?
Nothing.
Nothing. Digestion or absorbed? Nada. So you guys see how, again, sometimes nothing is totally fine. Like I should have left for the mouth. Wow. Okay. It's been a long day. So that's what I would recommend. Do it on a sheet of paper, do it in an Excel, whatever. But I would say, again, this will help you kind of go through your notes and keep things organized. Okay. All right. So I say let's take a little break, but then we're going to jump into GI patho. Okay. I know we're trying to get to the end here. We're kind of getting to the end. I have a very, very important announcement to make at the beginning when we come back. So just heads up there, just please make it back. Okay. So we'll say 15:10. So we'll go like 5 minutes, if that's cool. Run around, get some water. And then 15:10, we'll pick back up again.
Hey, Bryant.
Yeah.
Are the salivary glands an accessory organ or like part of the mouth or?
Oh, great question. So A, Don't care. B, not going to test you on that.
Okay.
Just
Sounds-
going to call it, yeah, I'm just going to call it the mouth.
Okay, thank you.
Mhm. Okay, so GI patho, a little bit of GI patho. Now, the reason why I really was trying to make a kind of big thing about this, GI patho, again, this is kind of near and dear to me, A, because it's my favorite, but B, because I have the most direct experience with it. One of the topics that we're going to be getting into, not today, but on Monday, will be eating disorders. Okay. Eating disorders are kind of a personal spot for me because I used to teach nutrition at CU Boulder. I'm not knocking on Boulder or anything like that, but there are a lot of students with eating disorders. Okay. Now, I have no illusions of where I work and who I work with. If you suffer from eating disorders or you have recovered from eating disorders, please let me know. Okay, again, we're not going to get into it today, but on Monday, we're going to be talking about eating disorders, and there might be some triggering images, some triggering thoughts, and I do not want to trigger anybody. A little bit about myself. I personally suffer from depression a lot. I don't want to put anybody's mental health in jeopardy. Okay, so this is just a PSA. If you have suffered from eating disorders or you are suffering with eating disorders, let me know so that way we can figure out an alternate so you don't have to come to lecture, be triggered, and go through all of that horrible, horrible, nasty shit again. Okay. So again, that's just me trying to give you guys a heads up. What we will be talking about with eating disorders is approaching it as a nurse. How do you start that conversation with a patient? How do you interact with a patient with those kinds of things? Okay. So again, just a PSA for Monday. Please let me know, just that way I can kind of help ahead of time. Okay. On Monday, it's kind of like the middle bit of lecture in which we kind of hit eating disorders. So the first and third part, no problem. Okay. So heavy PSA there, sorry. But for now, again, we're not jumping into that today. Okay. So your quiz on Monday will be just GI Phys, just GI Phys. Anything that we go over right now will not be on your quiz. This is just to give us a little bit of a head start on the material, okay? All right, so starting off with anorexia. Now, again, this is not anorexia nervosa, the eating disorder. This is just a general lack of appetite, okay? Lack of a desire to eat. Take, for example, food poisoning. Anybody ever suffer food poisoning? Do you want to go straight back to that restaurant the next day? Don't really want to eat it. That's anorexia, right? Vomiting. Vomiting is a forceful emptying of the stomach. I do not underestimate the term forceful. There is no pretty way to vomit. Okay, no one's going to look like a Disney princess afterwards. This is a vital reflex. Okay, so somebody who has brainstem damage might exhibit vomiting uncontrollably. Okay, two symptoms we see is hypersalivation and tachycardia. Why? Why would I start salivating more after vomiting?
Maybe to like wash the stomach acid out of your mouth.
This is help to dilute and neutralize stomach acid. Nice. Okay. What is in my saliva that can help neutralize stomach acid?
Bicarbonate.
Yeah, you guys got it. So water and bicarbonate. Very good. Okay. Tachycardia. Obviously, again, it's forceful, right? There's no pretty way to do it. With tachycardia, you might see increased heart rate to compensate for the decreased blood volume. So this is someone who has been vomiting for several days in a row. Again, like really bad food poisoning. If you have less fluids, your heart actually beats faster. Try to help keep that cardiac output up. Nausea, don't really need to explain that one. Retching, the abdominal pain. Now, abdominal pain is poorly localized. Think about the last time you had a stomach ache. It was a dull aching. Don't think that's how you spell aching, but just roll with it. Maybe burning. Maybe it radiated. Radiating pain. Why? Nice. Because of your small c's. Correct. You only have small c's in your abdominal area. Very good. Okay, now you guys know in health assessment, when you assess the abdomen, that's why you do it in quadrants. Okay. Constipation. I was going to tell you guys a joke about constipation. Oh, well, I guess it's not coming out. Let's talk about diarrhea. Just run with it. Go with the flow. That's like 2 in a minute. I'm pretty impressed with myself. All right. Talking about diarrhea. 3 types of diarrhea. Osmotic diarrhea. So you guys remember osmotic oncotic, right? Osmotic oncotic, what did that mean? I will tell you more poop jokes.
It attracts proteins and nutrients.
Yeah. So osmotic is going to be salt / protein in the colon. Now, if you have a bunch of salt, a bunch of protein in your colon, what does salt and protein do?
Attract water.
Pulls water, and guess what comes out? Osmotic diarrhea. Okay. Secretory diarrhea. This is with a foreign organism. Not a foreign organ. We're not talking about Buzz Lightyear here. Okay, this is kind of like a parasite. This is the body's attempt to flush it out. Okay, motility diarrhea. This is when we kind of have a lack of peristalsis. Okay, lack of peristalsis. Remember, peristalsis pushes things along, but it also holds things in place. So if I have a lack of peristalsis, things are just moving through me too quickly. What's something that decreases peristalsis? What's something that somebody can take to decrease peristalsis?
Opioids.
Opioids can do it. Absolutely, can definitely make you backed up. Think about something a little bit more common to the daily.
Coffee.
Yep. Caffeine. Another one, weird one, is actually nicotine. Okay. So to those of you that enjoy your morning cup of joe, you know there's a ritual. There's a ceremony you have to observe. You have to observe before, calling the president or dropping the Cosby kids off at the pool. Okay, talking about GI bleeding now. And this one's not so fun, sorry. So your GI tract split 2 different ways here. Oh God. GI tract split 2 different ways. Upper stomach duodenum makes up the upper, jejunum on down makes the lower. Okay, understand this is kind of like a line in the sand. It can kind of change. In this case, hematoemesis. Anybody want to translate that? Hematoemesis.
Bloody vomit.
Nice. bloody vomit. So if a patient presents with hematemesis, that would indicate an active bleed where? Upper or lower GI?
Upper.
Upper. Okay, so I can write a question saying patients exhibiting bleeding in their esophagus and they vomit. What would the nurse expect? Hematemesis. Bleeding in the stomach, bleeding in the duodenum. Okay. Hematochezia. Now I know Lindsay pronounces it chezia, but I like to pronounce it chezia.
Okay.
Why? This is fresh, bloody poop. Fresh, bloody poop. It kind of has the consistency of Cheese Whiz. Hematochezia. See? That indicates a bleed where?
Lower.
Nice. Lower GI bleed. Very good. And then melena. This is your black, tarry kind of stool. Okay. Coffee grounds are coming out of your butthole. Indicates bleeding where?
Upper.
Upper.
Can be upper, yeah, because it's gone through the entire GI tract. That blood has been processed. Very good. Okay. So again, just understand this is a line in the sand. In reality, if a patient's bleeding out of their duodenum, I would probably anticipate hematochezia because it depends on how much blood is coming out, right? Line in the sand, just exam type question, upper, lower, that's how you differentiate. Sound good?
Why is melena upper?
Just because it's, if you're bleeding in, take for example, the esophagus,
Mhm.
that blood's gonna go to the stomach, get burned by acid, go to the duodenum, get burned by the pancreas, go through the jejunum, the ileum, get dehydrated, i.e. if you're bleeding in the upper, it's gonna go through the entire GI tract and get processed.
Okay.
That's coming out as like dark and tarry.
Okay, got it. Thank you.
Yeah, great question. All right, dysphagia. Phagia. Again, this is not dysphagia. Okay, difference is phagia, difficulty swallowing. That is speech. Speech. Okay. Achalasia is a complete de-innervation of the smooth muscle in the esophagus. So achalasia, your smooth muscle is no longer connected to anything. It's no longer wired. If a person has achalasia, what are they going to have difficulty doing?
Swallowing food.
Yahtzee. Yep. So there's no swallowing. Increased risk for choking. Okay.
So what's the difference between the two?
Great question. Achalasia is the worst form of dysphagia. So with dysphagia, you have difficulty swallowing, but you might be able to get some food down on some good days. Achalasia, you're kind of screwed all the way. You need a feeding tube. Great question. Both of them have an increase for choking. Don't get me wrong. Just achalasia has a greater risk for choking.
Is that why there's like the different dysphagia diets, like dysphagia 1, 2, and 3? Is there like different levels to the dysphagia? And then achalasia is just like you can't swallow at all?
I think so, but don't quote me on that. That's probably more of a Lindsay question. Yeah, I'm just kind of used to going straight to the feeding tube. Oh, great question. So what causes the achalasia, like the complete de-innervation? It could be multiple sclerosis, where I've demyelinated all of the nerves. It could be some sort of paralysis. It could be like maybe cervical trauma to the spinal cord. Absolutely. typically, I believe, again, I haven't seen stats in a very long time. I believe that it's more of a disease process rather than kind of an event. But you can see this with like strokes as well. GERD. GERD, gastroesophageal reflux disease. Okay, GERD, so is when we have a reflux of chyme from the stomach to the esophagus. Basically, we have backflow, we have regurgitation. Stomach produces mucus to protect itself. Does the esophagus produce mucus? No. So the issue here is if I have this reflex, this is going to cause burning and irritation to the cardiac sphincter or the lower esophageal sphincter or the gastroesophageal sphincter. That's what produces heartburn. Okay. Reflux esophagitis. Itis. What is inflamed here?
The esophagus.
Perfect. It's an inflamed esophagus. Again, why? It's because of all that stomach acid. Okay, so let's kind of think about this. Somebody has GERD, that backflow. That's going to cause inflammation of the esophagus. Now you have the sphincter here, the cardiac sphincter. If you keep splashing it with acid, what's going to happen to the ability for this muscle to close?
Decreasing.
It decreases, so it actually opens up more. If my cardiac sphincter opens up more, what does that mean for the amount of acid that gets through? More. Cardiac sphincter insufficiency. Cardiac sphincter insufficiency is the inability to close that sphincter. Okay. Cardiac sphincter insufficiency, inability to close that sphincter. Therefore, I'm letting more acid into my esophagus, which is going to cause what?
An ulcer?
It could cause an ulcer. I was going to say it causes even more inflammation, even more irritation. So GERD ultimately leads to more GERD. GERD leads to more GERD. Remember GERD. Okay. Could that lead to Barrett's esophagus? Great question. So with Barrett's esophagus, we're splashing the sphincter with this acid. With Barrett's esophagus, we're seeing that the cells are trying to repair, but they're constantly being exposed to this acid, so they're becoming dysplastic. That's why Barrett's esophagus is one of the risk factors for developing into esophageal cancer. Great question. Okay, so what causes GERD? Delayed gastric emptying. So let me ask you guys this. If you're going to an all-you-can-eat brunch with bottomless mimosas, are you wearing the yoga pants or are you wearing the tight pants with a belt? You got to get your money's worth, y'all. Okay, you bring your stretchy pants. I can't bring a blouse because, again, that looks weird. Okay, but you come prepared. Tight pants. I'm not kidding here. Tight pants, tight belt. That delays gastric emptying. So if somebody has GERD, you can tell them like, hey, wear more yoga pants. Okay. The other thing is after you eat all of this food, you're laying down. All of that acid is just sitting on your esophagus. So no laying down after eating. Okay. So you crush it. You get 5 plates of I don't know, chicken and waffles, 7 mimosas. You take a nap in the lazy boy. Not on the couch, but on the lazy boy. Okay, do it right. Exactly. So here again, just showing you that sphincter is not completely closing. That's your cardiac sphincter insufficiency. GERD leads to more GERD. Barrett's esophagus, if you're curious, it's kind of looking like that, where you're seeing these abnormal cells. All right, I know we're kind of at 3:30 here. You guys cool if we go for like a little bit longer? I promise it's not too bad. I have jokes. Promise. Hiatal hernia. And if you do need to head out, that's totally fine. I'll post the recording. No, I'm not going to try to keep you guys too long. I promise. Hiatal hernia. So whenever you see the term hernia, that means displacement. Something is slipped. Okay. Hiatal refers to the stomach. It's actually going through the hiatal, the hiatus, through the diaphragmatic hiatus, but we'll keep it simple. Hiatal hernia. Your stomach has become displaced. Two types. A sliding hernia. The stomach slides into the esophagus. Stomach slides into the esophagus. Okay. A paraesophageal hiatal hernia. Ooh, what a mouthful. You guys actually know what this does already. Use your Latin. What does paraesophageal mean?
Near?
Near or next to, sure. Next to what?
The esophagus?
So what has happened to my stomach? Stomach slides next to the esophagus. Okay. So in a paraesophageal hiatal hernia, the stomach becomes displaced next to the esophagus. So taking a look at it, here's sliding. Here is your paraesophageal hiatal hernia. So here your stomach has slid past that diaphragmatic hiatus into your esophagus. Paraesophageal slid right next to your esophagus. What's the problem here? Let's take a look at the paraesophageal. What's the problem if my stomach slides next to my esophagus? I don't know about you guys, but look at the size of that stomach. That's nice. I get to eat less. I'm going to lose weight. There's something that's going to happen first.
We'll put pressure on the esophagus and like close it.
The pressure on the esophagus is definitely going to keep it closed. Absolutely. You might see dysphagia. Absolutely. Let's think about the pressure on, that's better, this portion of the stomach. You're going to be squeezing that part of the stomach. If you start squeezing that, what happens to blood flow? Ischemia, hypoxia. So, what is your concern with a hernia?
Necrosis?
Yahtzee. So this is why hernias are considered a medical emergency. This part of my stomach can start rotting, can start necrosing within an hour. Depends on kind of how bad it is, etc. But think about, like, if your stomach starts necrosing inside of you, when am I going to start leaking inside of me? Stomach acid, pepsin, nasty stuff. Yes. Hernias are medical emergencies. Okay. Other hernias, umbilical, abdominal, let me just say mainly affects women. mainly affects women. Inguinal mainly affects males. Okay. Kind of explain why, but sorry, too fast. So taking a look here, the umbilical hernia, you see, what do you think is popping through? What's that protruding through the belly button?
Transverse colon.
Yeah, that's going to be the transverse or maybe even part of the small intestines, but it's going to be one of the parts of the intestines, okay? The reason why this is common in women, pregnancy. Y'all, when you incubating a baby inside of you for 9 months, there's pressure, okay? So that, and when the pressure comes out, et cetera, blah, 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 blah. What we need to go through is we need to open up this hole, put things back in and reseal it. Dudes, this is your inguinal hernia. Guys just have a larger inguinal canal. Back in the womb, when we were all tiny little shrimps, we all started with ovaries. I started with ovaries, okay? As a dude with a Y chromosome, my ovaries descended through the inguinal canal and became my testicles. That's why. Dudes with inguinal hernias, their intestines pop into their nutsack. I'm not a nurse. I can use these technical terms. So basically, a dude goes from being a bipod into being a tripod. Problem is swelling. Has anyone ever seen an inguinal hernia?
My dachshund
God.
had one.
Oh my God. How bad did it get?
They thought he had cancer.
Okay, people walking into emergency rooms with inguinal hernias look like they have volleyballs, basketballs hanging between their legs. If you have ever seen South Park, that episode where Randy Marsh tries to give himself cancer to smoke weed, you know what I'm talking about. That episode, that's straight up basically an inguinal hernia. Yeah. Absolutely. Pyloric obstruction, don't worry about it. Okay. Dumping syndrome. So kind of exactly as it sounds, dumping syndrome does make you take some mad shits, but for a different reason, okay? Dumping syndrome, basically we empty the stomach too quickly. Oh, an orange. Too quickly into the small intestines. Okay. We empty the stomach too quickly into the small intestines. So let's think about this. Your stomach, it's supposed to break down proteins. If we empty too quickly, that means I'm dumping proteins into my intestines. Can I absorb them? What needs to happen before absorption?
You have to break them down.
You have to break it down. You have to digest it first. So dumping syndrome, I don't break everything down. I dump it in there. I don't absorb everything. That's why it comes out with a vengeance. Okay. This is going to be mostly a risk for gastric bypass patients. Mostly a risk for gastric bypass patients. We see this pyloric insufficiency. Okay. So can I just show you a picture? Let me say you do not need to know this picture, okay? But I'm trying to illustrate this. You'll probably get into this with MedSurg 1. Here, the adjustable gastric band is the only reversible one. I put a cuff around the stomach, and I have this port, this syringe, or this port on the outside. I take a syringe of saline, I inject it into this port, it closes that cuff. Here's my new stomach. Anybody want to guess how much food you can put into that? Like half an egg. What's the main purpose of a gastric bypass then?
Decrease appetite.
Decrease appetite and therefore decrease weight. Okay, so after I stretch out that part of my stomach, I drain the hole, half the egg drops down, move on with my day. Problem is the adjustable gastric bypass, the adjustable band has the lowest efficacy rate because your stomach knows you lied to it. As soon as you drain it, the egg plops down here, your stomach's like, what the hell? And it makes you hungry again. The most common one is the Roux-en-Y gastric bypass. It looks trippy. So notice I cut part of the stomach. I take the intestines and I wire it to the new stomach right here. Do I have a sphincter anymore? So as soon as I take in food, goes into my new partial stomach, it goes right into my intestines. Do you guys see how that causes dumping syndrome? I leave part of my stomach behind because it's going to make acid. Now I can empty the acid down here, mix with the proteins. I can still break it down. I can still absorb it, but I can't slow it down. That's why dumping syndrome affects gastric bypass patients. Okay. Last one here. We don't really do this anymore because we lose the fundus. That's where your hormones are at. If we take out the fundus, this can leave a person feeling always hungry or never full or always full, okay, if they're lucky. So again, just understanding gastric bypass causes dumping syndrome. We good? And that's where we'll end it. Sorry guys, I know I ran like way over time. Hopefully you guys liked it though. Hopefully you can tell this is kind of like my favorite material, and I could say butthole a lot. So Monday, your quiz, just GI Phys. Also Monday, we will be talking about eating disorders. So please give me a heads up if that's going to affect you. That's totally fine. I won't single anybody out. And yeah, I'll see you all on Monday. Good luck with the rest of the week. Good luck with your papers. They're super fun. Not, I know. Bye, everybody. Oh, that's so cool, Caroline. That's so cool. I haven't seen anything. So if you have some articles or anything like that, just shoot me an email with a link in that. That's freaking cool. Because I know gastric bypass is pretty safe as it is, but yeah, if there's gut transplant, I mean like biota transplants, that's so much safer than surgery. Awesome. Yeah, be more than happy to look at it. Thank you. Thank you. Yeah, see you, Caroline. Lita, any questions for me?